I am an infusion nurse. Most of the infusion process has moved to outpatient settings, so that creates the opportunity for the nurse to work very autonomously, to interact with your patients and families very closely while delivering patient and family-centered care. This was perfect and fine and went well over here does not mean this is going to be the scenario over and over again. As a manager, and actually right now as a director, I mentor other nurses, stand beside them and provide quality care, answer questions, and work as part of a multidisciplinary team. Being an infusion nurse is very complex and requires working knowledge of many disease processes, many drugs. If they're having side effects, there's equipment, there's new IVs, and ongoing education as new drugs arrive on the market. As an infusion nurse, you will be responsible for checking the medications, checking the doctor's orders, making sure that you have another nurse working closely with you. Sometimes I'm Sherlock Holmes, delving into all the notes and all the information to better understand how we should be treating this patient correctly.
There we go. Okay.
You do see the bigger medical picture. You had been set to receive a drug that was potentially going to cause hair loss.
Yes.
It's not the disease we're treating the whole patient. A lot of the patients that we see have chronic conditions. These are people that you treat over long periods of time. You develop long-standing relationships and that trusting relationship.
So knowing I have that option available makes me think that my life's going to remain a little more normal.
Infusion nurses teach the patient about their drug. They teach their patients about how to navigate through life with a chronic disease.
And they're going to make sure the pneumococcal vaccine's in there.
Infusion nurses are charged with building multidisciplinary teams, working with pharmacists, doctors, advanced practice providers, other nurses, and also with that patient at the focus of their care. Nurses are true advocates for patients. And I know we got the code straightened out, but you were just really concerned about actually whether or not the bill was going to get regenerated. The infusion nurse understands that we need to know that the expense of the drugs are covered. We understand that it can impact that patient's financial quality of life. If you get something in the meantime, will you just give me a call?
Yes, I will.
We will engage and go the extra mile to find resources for the patients and families. She has lots of years experience with ports and IVs, so I wanted her to kind of share some of her knowledge with you today. The outpatient infusion nurse provides a large nurse effect because it enables the patients to have a quality of life. They can maintain their work life, they can maintain their hobbies and their family life, as well as managing their chronic disease. If you need anything.
Linda. Thanks for everything.
Okay. All right. I am a coach. I am an educator. I am a cheerleader. I am an infusion nurse.